Saskatoon is in the middle of an overdose emergency. Last week, over 3 days, there were 67 overdoses and one suspicious death reported to the Saskatoon Fire Department. It was enough to trigger the government to bring in the Provincial Emergency Operations Centre. That group is providing additional support to Saskatoon organizations and the Ministry of Health. Today on Blue Sky, we're going to check in with someone who is on the front lines of Saskatoon's drug crisis. We'll hear from an RCMP officer about what's being done to crack down on the toxic drug supply. And we'll hear from someone who runs an addiction treatment center. We know many of you have lost family members and friends to a drug overdose. If you have a personal experience with addiction, maybe lived experience, or have thoughts about how as a society we could get out of this mess, call 1-800-716-2221 or send us an email, bluesky@cbc.ca. So let's take you to the front lines of what's going on in Saskatoon. Kayla DeMong is the executive director at Prairie Harm Reduction in Saskatoon, an organization she's been with for 14 years, so she really has seen things ebb and flow. She joins us in our Saskatoon studio. Kayla, welcome to Blue Sky.
Thank you.
We know Saskatoon has had a problem with overdoses for a while now. I think it's something we're seeing kind of throughout the province, but it's particularly bad in Saskatoon. What's going on?
In January, Fire and us started identifying, some spikes in overdoses in 24-hour periods. And, these were really concentrated. We would see, I think it started with, about 12, then 19, that sort of thing. And it was, spiking and going down again. And then it just started, going up and hasn't stopped. And we've been in this crisis for the last, couple months trying to do whatever we can to support the community.
Before we dig into what you're actually seeing, can you, for people who don't understand what Prairie Harm Reduction's drop-in center is, can you explain how it works and what people are doing there and under what circumstances?
Yeah, for sure. Prairie Harm Reduction's drop-in center and safe consumption site is one of 5 programs that we operate. That program is designed to be, low barrier, a safe place for people in the community to access for a variety of supports. We have, it's a safe, warm place in the winter. It's a cool place in the summer. They have access to a phone. There's coffee, food served. So whatever we can do to create a comfortable space. There's case managers on site who help people with, a variety of barriers, but really focusing on health and housing and helping people get access to resources that they need and do a lot of advocacy out of that program.
Is there a typical, we'll call it like a mugshot or like a way that you would describe a person that would come into Prairie Harm Reduction? Because I think there's a lot of assumptions made by the public.
About 95% of the people that access that building are Indigenous. And we see a lot of people over the age of 40 who come and access those services. What we see, 99% of the time is somebody who is living without a home, who has a long-standing history with trauma, has faced a lot of discrimination, a lot of barriers in their life. We see a lot of people with very complex mental health needs and complex health needs, which contributes to the complexity of trying to find them the proper supports. It really, we try and look at it and realize that behind all of that is somebody who is a human being. They deserve supports and they deserve access to resources, and that's something that they've been denied their whole lives.
Kayla, it's my understanding that prior to the last couple of months, the drop-in center did not have to call in emergency help for an overdose for over a year.
That is correct. When we have overdoses on site with our paramedic on site, we're able to intervene really quickly. And so what would happen is, if somebody was showing the signs, then they were, their vitals were checked right away. They were put on oxygen. and supported medically through the paramedic, which, prevented us from having to use naloxone a lot of the time and prevented us from having to call emergency services, have somebody taken to the hospital when it wasn't necessary.
What's changed?
Well, what has changed in the last couple months is that the drugs are so toxic that we don't even have time to catch them before the overdose happens. 2 weeks ago, when we were testing drugs, it was coming back at about a 10% of fentanyl in the substance. We had some that also had benzodiazepines in it. So, people are dealing with the fentanyl overdose and then also having the side effects from using the benzodiazepine. Last week, that the samples went up to 30% fentanyl. So these are extremely strong. They're overdoses that are very difficult to reverse. And, we don't even have time to jump in and do anything beforehand.
When people are using these substances, is this a pills situation? Is this needles? Is this smoking? Just give us some understanding of how it's being used so we can understand how quickly the overdoses happen.
The majority of what we see are people smoking the fentanyl, and that's been pretty common since fentanyl has started, is that most of what we see and most of what we're experiencing is people who are smoking.
And so for it to happen that quickly, is that atypical? Is that weird?
It is, yes. And that is part of the difficulty in addressing all of this. And it's, the same pressures on fire is that because people are overdosing so fast, there's no, we can't go in and offer any sort of interventions that can, stop them before they're unconscious, before they've stopped breathing.
Now, obviously, when it comes to drug supply, the people who are using these substances at a drop-in center, safe consumption site, are not the only people using drugs in Saskatoon. These are just the people who've chosen to come in and do it in a space where they could be supported. How do you get the word out in Saskatoon that this is killing people or has the potential to kill people?
One of the things that has been such a gift, and I'm so grateful for, is that Fire has been very open about what they are seeing and where they're seeing it, which helps us paint a better picture of what is happening across the city, not just concentrated around the core area. We often assume that, when we hear these things, that's where it's happening. They're attending to overdoses all over the city. And this isn't just are folks who are experiencing homelessness, the people that, we look at and assume are using drugs. This is a citywide issue.
So tell me, the province has declared an emergency. They have an emergency response team that's going to work with the city and the health region. We did reach out to them and they said it's almost too early to say what they're doing to support. So I understand that they're trying to figure this out just like you are, but are they working with your organization? Have they been helpful so far?
Yeah, so with this emergency system that's been put in place, there's a group of people from the city that they then meet with and organize, and then the city group meets with community organizations. This started last Thursday. Unfortunately, where we're at and what makes it so difficult on, the front line is that this should have been done weeks and weeks ago. And so they're trying to play catch up and we're just trying to keep people alive. Like we are, way ahead of the need that they're trying to support at this time. We've been reached out to about a few potential supports, but there's nothing really concrete. There's nothing that can be put in place this quickly when there is this high of a need.
What does support even look like? What can they do?
Well, there's a few things. For us, we need medical support on site. We need somebody who is trained to respond and assess vitals, who can jump in quickly, who knows how to support somebody who is experiencing an overdose. My staff are exhausted, and this is what, my conversation with them last week is that The team in that department will keep on going, but it's not just this department that's dealing with this. Our family support department has been driving around for hours a night trying to hand out as much naloxone as they can. They've been finding people who have overdosed and attending to those. Our Kikanak Village program, our residential program, there has been overdoses there. And so the stress on our staff is immense, and the staff are terrified because we never know what's going to happen next. What we need people who can step in and take some of that pressure off of the staff and, give them a bit of a break from the constant crisis.
Okay, we're going to go and just pause here for a moment because I think advocacy is a big part of this. It's a big part of your job. Kayla, Heather Balfour has been advocating to address the overdose crisis here and nationally. Her 18-year-old daughter, Rachel, died in 2019 from fentanyl poisoning, and she spoke to the Morning Edition's Adam Hunter about it.
When you hear of this happening in Saskatoon, what's the first thing that comes to mind?
Well, the first thing that comes to my mind is I'm not surprised. I'm not surprised that it's happening in Saskatoon. It will happen in every other community in this province, in this country, because this is a problem that's been raging for over a decade, and I think more needs to be done to address it.
When it comes to the government having to respond with the Emergency Operations Center, what do you make of that?
I'm extremely encouraged by that. The Saskatchewan Public Safety Agency does amazing work for emergencies of all kinds in this province. And the fact that the Provincial Emergency Operations Center has been opened, I think does a couple of really critical things. One of them is it will help the first responders and the local authorities at this point in Saskatoon to try and manage this situation, because it's a crisis, and our regular methods and supports just aren't enough to manage this. So the Emergency Operations Center will help to coordinate that, provide some supports, look for gaps, try and find out what other things we can do to try to address this. And the second thing that I really like about the Emergency Operations Center opening is the public message that it sends. It says, this is a crisis. This is an emergency. Pay attention, because this is growing and we need to do something about it. This is a huge problem. And I think sometimes there are targets on governments not doing enough, health isn't doing enough, police aren't doing enough. And I think people are trying to make a difference, but this problem is huge. It goes way beyond Saskatchewan. And I would say, if I was going to suggest some things that need to be done a bit better than they are now, the first one is prevention. 7 years ago, this would not have been on my radar. I would have said, that's not going to happen to me. My children aren't going to take drugs. My parents, my neighbors, my friends, they're not going to take illicit drugs. And I've had an extreme eye-opener in the last 6 years to learn that, we are all at risk. These illicit drugs are so easy to get. People think about getting them on the street. Yep, you can get them there, but you can order them through the mail and they will show up in your mailbox. We need to find out why people, particularly young people, are turning to this as an option. We have such high rates of anxiety and depression in our young people right now. We need to start addressing prevention so that people aren't choosing this as their go-to to be able to manage what it is that they're struggling with in their day-to-day lives. So that's a big one for me. Another one is education, right? We have to stop saying, oh, this isn't going to happen to me, because it is going to happen to you. I can guarantee everyone listening right now, there is someone in your life, at least one person, who is actually struggling with substance abuse, because it is widespread and we don't understand that and we don't pay attention to that. And the third one I would say is treatment. And I know government's opening or planning to open a number of inpatient beds, which is great. But what we need to start treating these substance use disorder like a heart attack. You have a heart attack, you go to the hospital, you get immediate attention, immediate care, you get follow-up care afterwards. That's what we need for substance abuse issues. You can't put someone on a wait list and hope that 6 months from now, we can go in and solve a problem that needs attention right now. Since Rachel died, I have had so many friends, neighbors, people I know say, oh, you know what? My son is struggling with this. My nephew is struggling with this. I had no idea. And I'm afraid to talk to people because there's stigma around this, right? Oh, well, you get this sense that it's her own fault because she shouldn't have gone down this road. You know what? We all make mistakes. Lots of people make mistakes. Young people, particularly when they're still trying to find their way in the world, make mistakes, and they shouldn't be dying for it.
That was Heather Belfour. Her 18-year-old daughter, Rachel, died in 2019 from fentanyl poisoning. She was speaking with our Adam Hunter. We want to hear from you today, too. If you have experience with addiction, or maybe you have a potential solution to this problem, give us a call, 1-800-716-2221, or send us an email, bluesky@cbc.ca. I want to talk about where these drugs are coming from. Superintendent Glenn Church is with the Saskatchewan RCMP's Enforcement Response Team. He joins us now. Thanks so much for being here. Welcome to Blue Sky.
Thanks for having me. Appreciate it.
You know, you're hearing all of these stories. You're hearing about the advocacy. You're working on the other end of things, trying to see this kind of come to an end. Does this feel like you can ever catch up?
The previous speaker had so many great points. It's such a complex issue when we talk about addictions. But with respect to the RCMP and our other policing partners, really our role is to address the substances that are coming into the province illegally that ultimately fuel these addiction issues. So we've been very fortunate with the RCMP over the past 2 years to have created the Sask Enforcement Response Teams, which is part of the program I belong to. It was an initiative developed by the Saskatchewan government. We've had some really good success. Part of the mandate of these teams is to directly address integrated organized crime threats across the provinces, specifically Western Canada. So we have a team right now in Lloydminster. We have another one in Swift Current and one in Yorkton, whose mandate is to address interprovincial organized crime groups that make their profits off of these harmful substances that make their ways into our communities.
Do we know where these drugs are coming from?
Each case really is handled independently, and they come from a wide variety of sources. Some of the production could be, and when we're talking about a variety of different drugs, some of them could be produced locally, some might be produced in Canada, some of them are making their way in from other countries and from outside North America as well.
Okay. Last month, the government said it was going to bring in some changes to crack down on trafficking, on people using fentanyl and methamphetamine. I think there's a lot of people who would like to see drug trafficking cracked down on. How are you cracking down on this? Is it a case of, just getting it off the street, which I know is a big part of investigations in the battle, or is this infiltrating organizations? Like, how do you crack down on this at this point? It seems like it's everywhere.
It is really a complex problem. And I think really the RCMP, our main role is the enforcement side, and we leave the health professionals to manage the complex health issues surrounding this. The way that we crack down on it, so to say, is really to form an intelligence base. We do that working with our policing partners through the Criminal Intelligence Service of Saskatchewan. And that's an initiative where the executives and the working levels address organized crime issues collaboratively. And we're a large part of that, of the RCMP in the province. With that information, we are able to use the resources we have to the best of our ability to address the organized crime threats that have the greatest impact. We're working, as an example, routinely with our partners in Alberta, with the Alberta Law Enforcement Response Teams, and recently on the Manitoba border with the MILA teams, Manitoba Integrated Law Enforcement Teams, similar to ours. We're seeing these issues across the prairies in general. So the RCMP, along with our policing partners, have taken it upon ourselves to work together to try and address these, because organized crime groups are very sophisticated and they use jurisdictional boundaries to try and avoid law enforcement. So really, we're working proactively to deal with that.
as a superintendent, you don't just get to that rank overnight. That takes some time and experience. What have you noticed over the years from when you started as a constable and worked your way up in terms of toxic drug supply in our province?
Certainly in the days that I was on the ground working in that field, fentanyl was not on the radar. At that time, our main enforcement was cocaine at that time. So really, we've seen a transition in this province towards methamphetamine and fentanyl in the past decade or 12 to 15 years. So that would be my main anecdotal observation. I think also what we've seen is an increase in violent crime in this province, specifically gangs that are using higher levels of violence and intimidation in order to move these products, which are very concerning for communities and has also put great strain on law enforcement in the province.
Okay, moving back into the topic at hand today, we're talking about Saskatoon's drug crisis emergency. If you have experience with addiction or maybe a potential solution, we would love to hear from you. 1-800-716-2221 or send us an email, bluesky@cbc.ca. I would like to go to the phones. Jen is a teacher in Swift Current and has some thoughts. Hi, Jen.
Hi, Sam. Thanks for having me. I just first like to say my heart and my condolences to, for example, Heather, who spoke earlier, and all the people, family and friends who've been dealing with this. There's not an easy solution, but I think it's going to cost us. So I've been a high school teacher for 20 years. I've taught in Saskatchewan, BC, London, England, Russia, Ukraine, like a few places. And what I'm seeing with teenagers, that's my preferred age group, is that we need more counselors. Like right now, the counselor rate, for example, at the high school, I teach for SaskDLC, but the high school in Swift Current has 1,000 students. They have 2 full-time counselors, and then they also have a counselor that helps with the grad planning and things like that. But it's just not enough. I know the counselors in town that work at our center that's for teenagers, they are overrun. There's not enough people there. And what I'm seeing based on the amount of kids that I've taught over the years that were using drugs even 20 years ago, it has increased dramatically. And if we don't invest our government's money now, it's going to compound the cost of these people with their trauma when it becomes a capital T instead of a small t, when they don't get the help when it happens. We're going to pay more in the end because the severe health problems, the addictions, the rehab, all those things that happen with addictions, and never mind the cost on the family and friends and those circles of people. We have to be proactive. We have to say, okay, this is going to cost us up front. But then we're going to have people who've worked through their traumas, who aren't going to pass those traumas on to the next generation, who are going to be able to help the people around them because they've gotten help. So I think we need to look at it with a different lens. And I know that that's hard. And I know that, you go into the hospital and if it's an ER and you're not bleeding and it's not life-threatening, it's not treated as such. Mm-hmm. But I think what Heather said about her daughter and the stuff that she's learning and the active work that she's doing is we need to treat these early mental health issues and problems and crises as life-threatening because they do become life-threatening.
Jen, are you seeing drugs in the high school? And when I say drugs, I don't mean pot because, that is what it is.
Yeah, no, I know.
But are you seeing the harder drugs into the high school?
So I'm not currently in the high school. Because I teach online for the Saskatchewan DLC now.
Right.
But
when you were in the classroom,
I haven't seen it, but I know I was teaching kids that were high, and I've had one-on-one conversations with students who've said, that they were addicts already as teenagers, and because that's what they grew up with and that's what they knew. And they also, so many of these kids had really hard things. Some of them have lost both parents. Some of them have lost one parent. Some of them have, parents that, it's what Jodine Carrington says, people can't give what they don't have. So we have to give people the tools. We have to go back to the basics. We need to give people the counseling. We need them to give them the therapy. And we can't wait till they're in rehab. We have to catch it before that point, is what I think.
Jen, thanks so much.
Kids are hurting. And
yes.
And I was just going to say, right back to our elementary school teachers, my kids go to a school with 500 kids. There's one counselor, and she did have 3 different schools under her belt. So she can't see the kids with the small traumas. Mm-hmm. She's only dealing with the kids who are having serious mental crisis. So our government needs to put money where our mouth is, and we need to offer help to the kids when they're young, when they can still take that help and make changes in their life.
Well, tomorrow is budget day, so we will see how that plays out. Jen, Thanks so much for your call
Yes.
and for your insight from the classroom, online or otherwise. We appreciate you and all the work the teachers do.
You bet. Thanks so much. Have a great day, everyone.
I want to go back to Kayla before I bring in our next guest, because something Jen said really stuck with me. And she said, I know I've taught kids that are high. Kayla, when it comes to kids and developing addictions, what advice do you have for maybe noticing that someone, kids or otherwise, have started dabbling into things that could get them into into real trouble?
I think we kind of clump things together, and that caller was really correct. That if we don't put in the resources right from the beginning, this is where we end. And it can present different ways. You see youth who are addicted to stimulants who function relatively well. They're getting their schoolwork done. They're dealing with all sorts of pressures, but on the outside, they look very functional. And without having the proper resources in place, we may never catch those kids when they need to be caught. We also need to look at, the families that we have. Our family support department currently has a caseload of 350 families. And the things that we keep running into that are leading to substance abuse are housing instability, lack of mental health care, and lack of access to health care. Those three things are the cornerstone of addressing so many issues in our communities. Without housing instability, you are not able to then address all the other things, which is where, treatment gets very difficult. Because you can't go to treatment and then be released back into homelessness and expect to be successful. And so when we are identifying kids from a very young age who are dealing with, abuse and instability, who we know, parents are dealing with barriers and don't have the resources to address them, we need that investment so that we can start that early and we can support those families. And housing, mental health care, and health care are the three things that we need the most.
Before I move on, I know we were talking about money and spending and support needs. What are you hoping for in tomorrow's budget?
Well, I have lots of wishes for tomorrow's budget, and I'll be there in Regina. I think, it's very much what I just said. We're in a housing crisis. I truly believe that a lot of what we are seeing is because of housing instability. We have many people who are housed and very stable for a long time that we've worked with. And then all of this started, they're ending up on the streets and things spiral from there. We know the healthcare issues that are happening here in Saskatoon. We just saw reduced hours of one of our emergency rooms. This is not helping. And I don't understand why, something like healthcare, who affects everybody in this province, would not be a primary investment. We need access to mental health care, which has been said many times. And we need access to resources. Our education system is horrifically underfunded. Imagine what would happen if we had a place where kids could be engaged, where they get the supports they want, where they get education, and where, they have those, guiding pathways into their adult lives.
Okay, let's take a look at the other side of things, which is recovery. Andrew Love is the executive director of the Pine Lodge Recovery Center in Regina. He joins us now on Blue Sky. Hi, Andrew.
Hey, how are you?
Good. Thanks for making some time today.
No problem.
Tell us about the model at Pine Lodge. How does it work?
For sure. First, hi, Kyla. Nice to hear your voice. The way Pine Lodge works, as of April 1, we're now a 6-week inpatient program. We were a 28-day program, which was the historical model. The 28 days was based on insurance when these places were first started up, these Betty Ford clinics and that. It was all based around insurance. So no evidence to support that that's the right length of time or the wrong length of time. What we've noticed, though, in the 28 days, we have seen, over the years, it be very effective for us. But with the nature of substance substances now, and like the social issues that Kayla mentions there, it's made it increasingly difficult to connect people to supports in 4 weeks before they leave treatment. And she's right. You leave here houseless, you leave here without food security, you're almost destined to relapse. So one of the things that we do here is we try to bring a holistic approach to things. We know that traditional models don't work for everybody, so we provide all types of things that people could potentially engage with, whether it's faith-based, whether it's based in evidence-based best practice, cognitive behavioral therapy, general wellness. We use this place as a hub for connection. So any organization that we see that does work out in the community with people who are going to be leaving our center or already work with some of our clients, we want them in this building, and we want them presenting to those folks, and we want them connected to them before they leave. We're really stressing case management as something that is one of the most important parts of recovery for us, because the language being used now is recovery capital, and what that really is social determinants of health. So we're looking at areas in people's lives. Do you have a primary care physician? Do you have food security? Where are you living in proximity to like medical centers or whatever? Are you living with individuals who are actively using? We look at all these things. We assess what are the things that we're able to change while you're in here, or what connections can we make while you're in here to improve your recovery capital, which should improve your health outcomes when you leave here. For me, my working definition of recovery is a improvement in the quality of your life. And so that's a very personal definition for each and every individual that comes through here. What does an increase in the quality of your life look like? We understand that some people are going to leave here and they either don't have the resources, the understanding, or the want to maintain sobriety, but we engage them in the same way. If you're in here for 6 weeks and we've been able to connect you to a family doctor, your basic needs have been taken care of for, you feel loved, you feel supported, then we've done our job in here. We do provide psychoeducation to people and try to build these soft skills for resiliency, especially around emotional management. As like mentioned before on this, trauma is obviously a huge contributing factor here. So we don't have enough time to really address the trauma, but what we can do is provide people with skills to bridge them until they can get into a program that will address their trauma. That's work they're going to do one-to-one with a therapist ongoing past the scope of our programming.
Andrew, I'm wondering, because we talk so much about funding and what these things cost, you referenced the 28 days. I didn't know that that's where that came from. It was an insurance model. What does one patient typically cost you to run? What does it cost? What does one patient cost your organization?
For us, I don't know the exact number, but I know like provincially, it's somewhere between $200 and $350 per person per day, is sort of the average cost for individuals to engage in treatment. And of course, all the ones in Saskatchewan or the ones that we work with are publicly funded, so there's no cost to the individual. But when you consider the cost of an overdose, for example, police, ambulance, fire, emergency room, potentially ICU, those costs are astronomical.
How do people get in? Because you can't buy your way in. So how do you get in?
What we've tried to do is lower as many barriers as possible while still trying to maintain a safe environment. So we still have some policies and procedures that need review that are a bit of a barrier for folks. But for the most part, the way that we've made it is that if you are working with somebody who needs recovery, the referral's made and we get you a bed as soon as we can. We work really closely with the SHA and our partners at Detox to look at some of the higher acuity folks with some of those social things that, can't be addressed in a very short period of time that elevate the risk of their relapse. And, based on their history, relapse could be fatal or has been fatal, and then they've been brought back. So we have a little chunk of room for rapid accessing some of those folks. So, provincially right now, we're working on a centralized intake system where all individuals will be able to refer themselves individually. So the same way you call for mental health services, unknown what that looks like yet. This is like preliminary stuff that they're working on. But I think that'll open up the access for people to be able to call and refer themselves. And for us, the reason why we don't allow for self-referral right now is just we need an accurate picture of what their health needs are, because we aren't working with medical staff currently. So, if we had, say, a nursing team and a psychiatrist, we could do that on site, but we're relying on, the hospital or a nurse practitioner in the community to give us that background information just to ensure that they're medically safe to be in our facilities.
Andrew, you're looking at this ability to self-refer. We know that when someone is ready for treatment, you kind of have to go now, because there's no guarantee they're going to be ready even 6 hours from now. Is there a wait list? Are we forcing people who are ready to get into treatment to wait?
There's wait lists. We have a wait list. People have died on the wait list too. And the government is committed for more beds. That's fantastic from our perspective, for the recovery portion of that. That should open up that door for, hey, I'm ready, I need to go right now. We've done a good job, like I said, in Regina anyways, and speaking only for my center, of fast tracking individuals when we have no shows, right? So some of the days we'll have 3 people scheduled for an intake, and these are folks that are transient. They're not following a schedule. They don't know, they missed their intake. All of a sudden I have 3 spots open. That's when we're able to make a call to our partners at the SHA and say, who do you have that's super high acuity, high risk, or call one of my community partners. We work closely with this Regina Street team and a number of different organizations. We're like, who do you got? We can get them in right now. Who's sitting there asking you about treatment right this second? Sometimes we get people that shows up and they're not quite detoxed, or they need some detox. We have a really good working relationship with the Regina Detox, where if that's the case, they're not going to lose their spot. We're going to hold them and send them for medical assessment. When they're cleared, they come back and start their treatment.
Okay.
There's not a ton of capacity to do that. That can definitely increase, but it's there.
It's an option. I want to go to the phones. Maria is on the line in Swift Current and has some personal experience. Maria, go ahead.
Yeah. I'm 18 months sober now. But it's a hard struggle. But, I think we say this is a complex issue, but I think we're making it more complex than it is, because we're refusing to have complete honesty about this issue. And the thing is, these things are symptoms of a toxic culture. And we're treating people like machines, and we're super controlling. There's this Buddhist saying, create a place you don't need to escape from. We have highly repetitive jobs that are hard on the body, depressing, make you feel hopeless, and you send kids to school, and if they don't want to sit in a desk, instead of nurturing them and respecting the diversity of the human brain, we are drugging children because they don't want to sit in their desk. And I think we need to understand how our institutions are harming us. And when we talk about truth and reconciliation, people lived freely. As we've segregated families, segregated communities, and created a dog-eat-dog world. It's the Hunger Games, and we won't admit that it's the toxic culture. And I think the real criminals are the people that are upholding the system when we know how toxic it is. Sorry, this makes me angry.
Well, Maria, thank you.
It makes me incredibly angry.
Well, thank you for your thoughts, and congratulations on 18 months sober.
Thanks.
We have an email, too, from Tim in Saskatoon. He says, I think part of the problem with addiction is oppressive life conditions, with people reacting to that by using drugs to numb the mental and physical pain. To help tackle the drug problem, we need a society to make available other life options that provide relief from those conditions. Since working for a living takes up the largest part of a person's day, there needs to be another options beside laboring for a private sector wage. In the typical private sector job, the employer controls every minute of your working day. And he goes on to say, basically, we need some courage to resist the status quo and get out of a hamster wheel. And, Kayla, as we're hearing from people, and we hear from Andrew on how the system works in terms of recovery, and then we hear about the potential for involuntary addiction treatment centers, particularly in Alberta, where they're going to spend $180 million over 3 years to build 2 centers. What are your thoughts on that in that kind of control?
Well, it's no different than sending somebody to jail, right? Like, it's a very controlled environment that you're forced to be in, and that rarely is successful. We see people already that are court ordered to go to treatment, or it's part of their probation, and it comes down to those basic needs and that stability in their life. If they don't have the stability, accomplishing a lot of those things is very difficult. And, it is the policy makers that are creating these systems that we can't necessarily function in. And, we see this every day. And I think one of the things that people often mistake about what we do is we send people to treatment all the time, but they have to be able to have those supports outside of treatment, just like Andrew was saying. We can't force somebody in there, expect them to do the work that it takes without providing them transitional support out there. There is fantastic examples and models of treatment that work really, really well. But it is longer term, and we need those resources. And what we need is policymakers to recognize that they need to invest in everybody in their community. When we put out our call out for money to help purchase nasal naloxone, because it's easier for people to administer and it's a lot less intimidating than a needle, we did that because we don't get money in the province to anybody to purchase those supplies. Within a couple hours, we had enough money. We had $5,000 to order kits. Then we had $10,000 by midnight to order kits. The people of this province care greatly, and that's, can be seen year after year with the support that they give for us to keep our drop-in doors open. Mm-hmm. But it shouldn't be up to them. The policymakers need to see what the reality is and the impact those policies have, and they need to invest back into their community. Toxic culture is very much created by those policies, and, there needs to be realization that they're responsible for everyone. And, so when we look at all the things that needs to happen, it starts in those rooms where the policies are being developed and things are being implemented. Forced treatment, it is no different than jail. Like, it has no positive effect, no more than our jail system does.
Andrew, I'm wondering if you have feelings on the so-called involuntary addiction treatment centers based on the model that you guys work with.
For me, I would have to see what the plan looks like, what exactly it entails, because I've seen success in models, say, with mental health warrants and having people kept safe through mental health warrants. But does that translate to addiction in the same way? I don't know. I have no expertise on that, and I don't know what that entails. Could there potentially be a way of doing this that is humane, respects people's sovereignty and their own health sovereignty and their own, I guess their autonomy. I would have to see exactly what that looks like in order to make any kind of educated comment on it.
No, that's fair. We have an email from Bill, and this one will go toward Glenn when I'm done reading it. It says, my question is, what happens to the drug pushers when they get caught? We've tried everything you can imagine to try and deal with this out of control problem. The drug suppliers need to be severely punished, as we all know. They're killing people, especially our young. Our laws must change to allow our police to be able to deal with this extreme problem. Our police risk their lives bringing these people to justice. Anyone that's remotely affiliated with dealing illegal drugs should be never released again. We've tried Band-Aid solutions, and it has not worked. Aside from the commentary on what this person believes the punishment should be, Superintendent Church, I'm wondering if you can speak to how often are you going into homes and enforcing this? Like, is this something that is happening every day? Is it take months of investigation? Can you give us a sense on that?
Sure. Yeah, absolutely. I think to speak to maybe the more complex investigations, as an example, if the teams are working on an investigation that is a more sophisticated organized crime group that's working interprovincially, those investigations could be several months, maybe even a year long. Just ballparking some figures. Some of them are more reactive and less proactive. If we receive a call from the community indicating that there was something present, or a drug trafficker, we may use that information to take an enforcement action. It is happening often. I can say that as an example, last year, the Sask enforcement response teams executed over 800 arrests, laid over 1,000 criminal code charges, and seized about 18 kilograms of illicit substances from the province. And on the fentanyl issue specifically, just to for anyone who's listening and may be interested, it's important to know that these problems with respect to fentanyl and other opiates are in Saskatchewan. In 2023, our CERT team seized 10 kilograms in a single seizure of fentanyl that was in Saskatchewan, moving into Alberta. And then the other piece was the roving traffic unit under a combined traffic services section recently seized 8 kilograms of fentanyl in a single seizure on a traffic stop in Saskatchewan. So these issues are in the province. So it's really important for, if possible, our community members to be tuned into what's happening in their local areas. And we encourage them to call law enforcement whenever they feel it's appropriate.
Thank you for that. Kayla, I want to kind of do last words with you because as Superintendent Church pointed out, this is here. I remember a couple of weeks ago, Saskatoon police had a massive drug bust of fentanyl and it was rainbow colored. And I had no idea that I always assumed fentanyl was pills or patches or whatever it is. So can you give us just a quick rundown of what some of these drugs might look like if someone were to stumble across them in their home or something like that, to know that maybe someone in their house is using something that isn't what they think it is?
Yeah. So PHR does the drug testing for the city of Saskatoon and the area, essentially. We have a spectrometer on site that can tell us everything that's in a substance, and then we use testing strips for 5 different substances as well, just to, confirm those numbers. But what we see is that it often looks like chunks of things, but every color, like there's no, there's no one color. A few weeks ago when we were testing samples, there was a light pink, a purple, and a red. Well, the light pink and the purple came back as the most toxic. The red didn't, and it switches around. Our tests that we did last week, it was more of a brown color. So what does that mean? Is there other things in here? And so, you can't just say, oh, this one's yellow. It doesn't mean anything, or it's fine, because in a week, yellow could be the most dangerous thing. And, part of having these identifiers and being able to provide this drug testing information back is that we've been able to provide it to police, to fire, to EMS to look out for. It's provided back to the province and can help identify, where things are coming from and what is happening. With, what we're seeing in Saskatoon, these drugs have completely saturated the market. It's the only thing that you can get. And so that makes it really complicated, because if you are someone who has a substance use disorder, you can't just stop using, because that's very dangerous physically without the right supports. And again, it's much more complicated about, stopping and that sort of thing. But if that's all you have access to, that's where we've seen these huge spikes in overdoses, because there is no alternative. And even to the point where, around our center, we have people that do trade drugs for lots of reasons. We don't see big-time dealers or anything around the building. But what we see is that, a few people that we, had heard of in community, or what we're hearing from our folks around the drop-in center, is that some dealers aren't even dealing fentanyl right now because of how dangerous it is, and they can't get anything else. So that's an anecdotal summary of that. But
oh, wow.
The drug testing is so important, and we have such limited resources, especially in rural areas, to do so. We're one of 4 locations right now that have spectrometers in their cities. And so, we're the quickest way to access those information. So a lot of what we've been doing through all of this is getting as much as we can to test and getting that information out as quickly as possible.
Kayla, thanks so much for taking some time away today from everything. I really appreciate you just really helping shed a light on everything going on. Superintendent Glenn Church, thank you so much for your perspective from the RCMP policing side of things. Kayla DeMong is the Executive Director at Prairie Harm Reduction, and Andrew Love is the Executive Director of Pine Lodge Recovery Center in Regina. If someone is overdosing or you think they are, call 911. That is the best thing you can do to save someone's life.